Hi, and welcome back to Mad-Endo. My name is Morgan, and today we're going to be talking about endometriosis. In this first segment, because I've broken it down into two segments, we will get into what is endometriosis, its definition, and some of its types. The next segment, segment 2, will cover endometriosis, some levels of its severity, some symptoms, and a little bit on surgical removal. So, let's get into it. So obviously I've written a little bit of a script, which I'm going to go over with it's just a light overview. What is this disease that we have? So what is endometriosis? Endometriosis, often referred to as endo, I refer to it as endo as well, is a chronic and complex condition where tissue similar to the lining of the uterus, the endometrium, grows outside of the uterus. These growths can appear in the ovaries, fallopian tubes, bladder, intestines, and other areas of the pelvic region. Also, in extreme cases, there are circumstances where endometriosis can travel outside of the abdomen. There have been cases where endometriosis has affected the lungs, I believe, but don't quote me. Also the spine and brain. Very rarely does that happen, but don't quote me that does happen, but somehow that's in the back of my mind that I've heard of that happening before. I'm going to try and find some more information on that, though. So yeah, I don't know if there's another name for this type of endometriosis, the kind that leaves the abdomen in these really sort of unique cases. I don't know if it's another type. Perhaps it's a combination of things that can bring about the circumstances. I do hope to get accurate information on that kind of endo, on the endo that does travel outside of the abdomen and migrates to these other areas of the body. But anyway, let's continue. Just like the uterine lining, this tissue reacts to the hormonal changes of the menstrual cycle, building up and shedding. However, unlike normal menstruation, this blood has no way to leave the body, causing inflammation, scarring, and pain. Okay. Yeah, let's take a moment to point out a few things. It affects people of all races and ages, including teenagers, yes, teenagers, and individuals who are not sexually active. So yeah, it's got nothing to do with sex. Symptoms include severe menstrual cramps, chronic pelvic pain, painful intercourse, and infertility. That's just, a light overview. There are many symptoms depending on the type that you are experiencing or you have that you can. There are many symptoms you can experience depending on the type that you have. And yes, it is absolutely possible. And I think, don't quote me again, but I think it's common to have more than one type of endometriosis. But again, we'll talk about that a little later. So, endometriosis is not a sexually transmitted disease and is generally, I like to say generally, not life-threatening. I say generally because it can lead to serious complications if untreated, including chronic pain and infertility. And beyond that, it can, the symptoms at an extreme level can greatly impact your life. So though your life might not be threatened, your life could change, maybe temporarily, but nevertheless, change it can. While there is no cure, treatments like hormonal therapies, surgery, and lifestyle changes can help manage symptoms. We will get into this in greater detail on this channel. Endometriosis is an underdiagnosed and often misunderstood condition. Yeah. If you suspect you have endometriosis, early diagnosis and management can improve your quality of life. Yeah, I have a little note here like, good luck with the early diagnosis part. I mean, we're making progress, right? But it is still a huge issue. And even if you are diagnosed, you still could run into a lot of doctors that don't take it seriously, don't help you because they don't know or understand the disease. They don't know or understand that it's a serious issue. I knew I had endo for many years. I informed all my doctors that I had it. They all knew, and yet it took becoming disabled before I found the help I needed. Again, we'll get into that in the details a little later, but this is, I'm Canadian. I'm in the Canadian healthcare system, and I'd love to interview people that have experience in other healthcare systems as to how they've been treated with endometriosis. But Canada's got a long way to go. It's amazing that I've seen over the past few years how far we've actually come along. It's nice to see that. We still have a long way to go, though. So let's get into some of the types of endometriosis, okay? Types of endometriosis. Endometriosis is categorized into different types based on the location and the extent of the tissue growth outside of the uterus. Here is a brief overview of the main types. Superficial peritoneal endometriosis, the most common form, where endometrial-like tissue grows on the peritoneum, and I don't know if I'm saying that right, the lining of the pelvic cavity. It can cause pain, adhesions, and scarring, especially around the ovaries and the fallopian tubes. The second one, ovarian endometriosis, endometriomas, occur when endometrial-like tissue forms cysts on the ovaries known as endometriomas or chocolate cysts. These cysts can cause significant pain and may affect fertility. The third is deep infiltrating endometriosis, DIE, a more severe form where endometrial-like tissue grows deeply into the surrounding tissues such as the bowel, the bladder, or rectum. It can cause chronic pain, digestive issues, and urinary problems. The fourth kind is now I'm not probably going to say this right, adenomyosis. Though technically a separate condition, it is sometimes grouped with endometriosis. This occurs when endometrial-like tissue grows within the uterine wall, leading to symptoms like heavy periods, cramps, and pelvic pain. So I think it's not necessarily considered the same type of endometriosis because it stays within the uterus, but it's still something that's growing and causing issues in the similar manner. These types of endometriosis differ in severity and the organs they affect, with treatments and symptoms varying accordingly. Endometriosis is a complex and often misunderstood condition. If you suspect you have it, early diagnosis and intervention can significantly improve your quality of life. Try and get yourself in to see a specialist so you can get yourself a treatment plan and learn a little bit more about some of those alternative sort of supportive methods or treatments that can help you manage your symptoms. Another great source of information is the Endometriosis Association, even I think the Endometriosis Australia. Look those up for more resources if you want to get more details. Okay, so I'm going to touch on something that's a little bit of a sensitive subject. I already touched on it a tad earlier, and I'm going to touch on it again. You're going to hear me say it in the second segment as well. So, yeah, you're probably going to hear me say this multiple times. The reality is, at least in the Canadian healthcare system, is that GPs or general practitioners are not as informed as they should be about endometriosis, which most often results in not getting diagnosed until things are at a severe stage or not at all. It can result in unneeded treatments or treatments that inflame endometriosis symptoms. Even when a doctor knows you have the disease, more often than not, at least in Canada, they still don't get you the treatment you need. Also, having endometriosis very often results in GPs being, and I hate to group y'all in one group here, but this has been my experience, and I know it's been a lot of women's experience, and so it's frustrating. And because it's been the majority of my experience, I have had this where what I'm going to say here is that also, having endometriosis very often results in GPs being very dismissive of us because they don't believe us, they don't believe we have issues, they think we're exaggerating or making it up. And it's because they don't understand the disease, they don't know how to diagnose it or recognize it, they don't have the knowledge, or they don't care. It's hard. I know that's a bit harsh, but that's just, that I have seen a lot of doctors in this country Once I got diagnosed in about 2007, like after surgery, completely confirmed, not guessing, we think you have. No, you absolutely do have. Doctors tried to help me doing things that I found out later were actually things you shouldn't do with the endometriosis. I definitely got a lot of, side looks, dismissive things as if I was making it up or exaggerating. And I know for a fact it's been a lot of our experiences with doctors, and it's unfortunate. And I'd rather be sitting here saying something completely different than that. And I don't like grouping, and saying this, overcasting or overshadowing or whatever overarching statement that is so inclusive. But unfortunately, I'm in my 40s. I've seen a bunch of doctors, and it's not because for any reason. It's because I've been traveling. I traveled a bunch. I lived in different places in Canada, but I always kept my doctors informed as much as I was informed. Now, remember, I am in my 40s. So, in the 90s, endometriosis wasn't even a thought. In the 2000s, barely thought of. The 2010s, now we're getting somewhere. So, it's not that I want to give them an excuse, but this is unfortunately, this is the reality of women suffering from healthcare issues where when a doctor doesn't understand the disease, they are dismissive. And I know you've all experienced this a lot. So, yeah, I know a lot of you know exactly what I'm talking about. So, know your body, know yourself, help yourself as much as you can. Document your own treatments. So when you do find a doctor that does understand this disease and can help you, give them all your history, as much details as you can, because it only helps especially your specialist treat you more effectively and understand where you're coming from. Unfortunately, currently, at least in the Canadian healthcare system, a doctor will ask me questions about a surgery I had, and I'm not a doctor, but I need to somehow remember things about the surgery. Some doctors don't want to hand over their notes to the other, pass on their notes to the new doctor. They don't hand over their files. And now you're sitting here, can you remember what kind of surgery you had? Was it open? Was it closed? Did they do this? Did they do that? I can remember as much as I can tell you. But if you're going to start getting into, specific details, going to ask, detailed questions, I'm probably not going to be able to answer that. And so that's why it's important to document stuff yourself so that you can at least have as much of an answer as you can for your doctor when they ask you questions. Because if you are switching doctors, unfortunately in this country, you're probably going to experience some doctors not handing over their files to your new doctor. Now, that being said, things are improving a lot over the past few years, which makes me very hopeful. There is a long way to go, as I've already said, and we do have a lot of wonderful medical practitioners on our side. They might be few and far between, but they are there. They are fighting for us. They really are. And they are growing in number, which is amazing. There are also other professionals that perform supportive treatments on endometriosis patients, like pelvic floor therapy, for example, and they are also advocating for us. It can seem like we are alone, but we are not. And more people are joining in the advocacy. Thank you for joining me today. Stay strong and remember you are not alone. I'll see you in segment 2. See you next time. Bye.